reporting live in where you should be subscribing to what's keeping you thriving. What's keeping you thriving? What's keeping you moving? I hope you're walking with a limp. You see me, health is wealth. I'm out here in the wilderness, in the wilds, walking with a limp, walking with my lymphatic. Today is a magnificent day, and we will be discussing some things that are very dear to me. I have a smoothie here, and it will be guest starring me and Papaya, going back like babies in what? Babies in who? Babies in pacifiers. Yes, indeed. It's Papaya fire. So what's in this smoothie, you might ask? There's papaya. There's the seasonal muscadine grapes. There is kiwis. There is a few other ingredients that I'm gonna save. Keep those top secret. But most of all, the main ingredients to start this off is papaya and kiwi, because papaya is really great for digestion and kiwi is really great for digestion. You put them together, your body can focus on other things besides digestion. But we will be talking about gum disease, problems with dental issues. Did you know that having sickle cell or having sickle cell trait or being anemic makes you more susceptible to periodontal disease, gum disease? And I found an article from the National Institute of Health talking about how papaya helps teeth, papaya teeth. So in this article, we're gonna be discussing the clinical efficiency. You know what, we're gonna do this one backwards because we don't have to stick by the rules. We're gonna do this one backwards. We're gonna go with the conclusions first, what happened, the result, and then we're gonna go with the experiment. So the conclusion of the clinical efficiency of topical administration of standardized fermented papaya gel. The present clinical laboratory study showed the remarkable, scientists don't like to use words like remarkable unless something's remarkable, but let's continue. The present clinical laboratory study showed the remarkable and durable clinical efficiency of topical administration of standardized fermented papaya gel for patients suffering from moderate to severe chronic periodontitis. Positive clinical results were associated with a normalization of the inflammatory and anti-inflammatory cytokine pattern and of the pro-inflammatory metabolites of nitric oxide in gingival crevicular fluid and blood plasma. Clinical and biochemical anti-inflammatory effects of fermented papaya gel preparation were partly attributed to its indirect antibacterial impact through the inhibition of adaptive antioxidant response in bacteria to intracellular oxidative stress phagocytes. Wow, magnificent. Simply superfluous. That's papaya fire, no liar. Okay? That's papaya for your teeth. Now we're gonna go over their experiment. The clinical efficiency of topical administration of standardized fermented papaya gel, known to have antioxidant and anti-inflammatory properties versus conventional therapy, was evaluated in a group of 84 patients with moderate to severe periodontitis, randomly assigned to control group, undergoing traditional pharmacological surgical protocols, or to experimental group, additionally treated with intragingival pockets. They got 7 grams of papaya gel for 15 minutes in their mouth for 10 days. So 7 grams of papaya gel for 15 minutes in the mouth for 10 days. Patients undergoing the papaya treatment showed significant, durable improvement of 3 major clinical incidences of disease severity: reduced gum bleeding by day 7, plaque and gingival conditions were under control by day 14. Interesting. Me and Papaya. What? By day 14, plaque and gingival conditions were under control. Gingivitis, plaque. And consistent gingival pocket death reduction was accumulated by day 45. So the gingival pocket death the gums were receding, and by day 45 they were able to reduce the recession of the gums. All right. So where are we? I got excited, y'all. See, I got excited. I cannot hide it when I get excited. All right. By day 45. So the pro-inflammatory nitric oxide metabolites reached normal values in plasma by day 14. And gingival crevicular fluid at day 45 was normalized with the papaya applications, compared to controls that did not reach normalization. Levels of highly increased pro-inflammatory IL-1B and IL-6 and suppressed anti-inflammatory cytokines normalized in the papaya group by day 14. Me and Papaya going back like babies in who? Babies in what? By day 14, they were able to normalize the highly increased pro-inflammatory markers, right? And let's see what happened. And by day 45, the GCF, the gingival crevicular fluid, but never in the control group. Although not acting directly as an antibiotic, papaya acted in synergy. Papaya worked as a yin-yang effect, as a I push, you pull. They work together. I pull, you pull. You know what I mean. I pull, you pull. We pull together. They work together. So this never happened in the control group. Although not acting directly as an antibiotic, papaya acted in synergy with human granulocytes, blocking adaptive catalase induction in the S. aureus in response to granulocytes derived oxidative stress. Is great for oxidative stress. Enhancing intracellular bacterial killing. The bacterial killing that was intracellular, it enhanced it with papaya. Papaya, no liar, is fire. Me and Papaya going back like babies and pacifier. And it's great for building muscle. Muscle indeed. Look at that muscle. Look at that. I'm not even flexing. It's great for muscle. So guys, gals, get you some papaya. If you have sickle cell, even if you don't have sickle cell, if you got teeth, even if you don't have teeth, you got gums, you need papaya. The antioxidants, the phenethyl isothiocyanate, the benzyl isothiocyanate will fumigate whatever parasites you have in your mouth. Not only that, but it will literally break off accumulated plaque. Accumulated calcified plaque will break off in your mouth if you use papaya gel. And you can make it at home. All you need is me and papaya. Well, no, you just need a blender, some papaya, so a little bit of water if you want. I mean, you can add different things to it. I'm not gonna go into my recipe because that's gonna be for a different episode. But if you just have papaya, it'll work. If you have papaya and you use the seeds with it, if you have papaya and you don't use the seeds with it, it'll work. But for a higher sense of efficiency, myself personally, I would recommend the seeds because they're packed full of benzyl isothiocyanate, and phenethyl. I like to call her Big Ethel, Sister Ethel. For real, because she hold it down when it comes to the parasite killing and the antibacterial, antimicrobial, anti-fungus, anti-mutagenic. You know, the mutagenesis, things can mutate. But not when Big Sis Ethel is around. Enjoy yourself, don't destroy yourself. Me and Papaya going back like babies in who? Babies in what? Pacifier. All right.